Hi, I'm Tina Constantinou, a naturopathic doctor with over 20 years of experience working both in a clinical and hospital setting. I help women in their 40s and beyond manage their health and wellness concerns. My job isn't to give you a straight yes or no answer, but to help you understand the nuances of both sides so you can make the best decision for your body and your stage of life. And because I rarely give a straight answer to my patients have lovingly called me Doctor Yes No. So today I want to tackle the question on whether or not you can actually get pregnant naturally in your 40s. And as you've probably guessed, the answer is both yes and no. Probably heard that it's almost close to impossible, the age of 40 and beyond, but is that really true? It's not impossible, but the odds do drop significantly. Still, we meet women every week who are able to get pregnant naturally in their 40s or get naturally using their own eggs in their 40s with IVF. So today we're going to break down the science and what it actually says about fertility after 40, so what you can do to help yourself if you fall into that age range. Let me tackle first, it's not impossible, but the odds do drop significantly. The no or highly unlikely for you to get pregnant in your 40s, because by the time you hit 40, the average chance of getting pregnant each month falls to about 5% compared to 20 to 25% in your 20s. And by the age of 45, that's around 1% or less. But that's the average. Remember, that's not you, that's the average. Studies reflect large populations, they don't reflect you and individual biology. The women do come in their 40s to the IVF clinic here that I work at, and they do conceive naturally, especially if they still ovulate regularly and have a healthy partner. The main reason for the decline is egg quality. As we age, number of healthy eggs we have decreases and chromosomal errors increase. So that's not going to carry a viable pregnancy if your DNA is damaged. But there's a growing body of evidence showing that environmental factors, diet, metabolic health also play a significant role in how fast or slow that decline happens. So while age does matter, biology isn't the only thing that matters. So let's unpack a little bit about what's happening inside the ovaries. Every egg has a limited lifespan. It's been sitting in the ovaries since you were born. And over time, it gets exposed to oxidative stress, inflammation, endocrine disrupting chemicals. All of these can damage the DNA of the cell and reduce the mitochondrial energy. That's why older eggs are more prone to chromosomal errors, like an extra chromosome or a missing chromosome, which increases miscarriage risk. Sadly, roughly 30 to 40% of pregnancies at the age of 40 result in a miscarriage because of chromosomal errors. But what's interesting is that not all women experience the same level of decline. Factors like blood sugar balance, thyroid function, vitamin D status, and antioxidant levels can actually influence your egg health. Don't forget, you also have to take into consideration the quality of your uterus, the thickness of the lining, and whether or not there's endometriosis, scar tissue, adenomyosis, and other pathologies. In other words, your biological age and your chronological age aren't always identical, and sometimes that can be used in your favor. So the actual odds of natural conception over 40 is about 40% of women aged between 40 to 44 who try for a year will actually conceive, although not all of them will result in live births. Still, that's not zero, it's not impossible, it's totally possible. And the difference between success and failure often comes down to the timing of ovulation, the health of the partner's sperm, and the overall metabolic resistance that the patient has. Think diabetes, PCOS, hypothyroidism. So while fertility clinics often talk in statistics, the reality is more personal. We've seen women at 42 conceive naturally after addressing thyroid imbalances, inflammation, environmental burden, or small changes basically that add up to big differences. So while yes, fertility does decline with age, it's not a complete shutdown at 40 and there's still a good possibility. So if you're over 40 and you're not ready to throw in the towel yet, especially with your own eggs, and you have it in you to try for another 6 months to a year or so, whatever it may be, here are the science-backed things that you can do to improve your chances. Number 1, support egg energy and mitochondrial function. Supplements like CoQ10 have been shown to improve egg quality and embryo development. This is a fat-soluble antioxidant, so it's best if you take it with some fatty food. Also note, if you're on statins, they tend to decrease the amount of CoQ10 that your body can absorb, so you actually have to put those back into your body to balance off the statins. 2, adopt a Mediterranean lifestyle. It's high in olive oil, fish, leafy greens and legumes, low glycemic grains, all of these help fuel your ovaries. The Mediterranean diet has been associated with higher IVF success rates and improved ovulatory function and better metabolic health. It's a win-win across the board. Number 3 is a really hard one for women. I know, this is probably my Achilles heel. Manage stress and sleep. Elevated cortisol interferes with ovulation and hormone signaling. Aim for 7 to 8 hours of quality of sleep and try mindfulness and movement practices throughout the day to try and keep your levels low. Number 4, check your thyroid and vitamin D stores. Low thyroid and vitamin D levels are linked to implantation issues. And 5, which is a big one because it's kind of ubiquitous, it's everywhere, is try and limit your environmental burden. So basically that means reduce plastic exposure, especially BPA and phthalates. This means you choose organic when possible. Use glass and stainless steel instead of plastics. Don't put your plastic food containers in the dishwasher or heat them up in the microwave. Studies show that avoidance of these 3 months prior to trying to conceive, you can actually see a decrease in the amount of BPA and phthalates in you. Your body can actually remove them. So for BPA, that takes roughly 6 hours, give or take, how your own enzymes function. And phthalates take a little bit longer, clocking in at 12 to 48 hours to be removed from the body. The problem is that you're always being exposed to these, so you have to be vigilant about what you're putting into and onto your body because a lot of these are also found in creams and perfumes. And I'm not even going to get into the forever chemicals, which persist forever, basically years and years in our bodies. You don't really have that much control over that, but you can control the plastics you bring into your body. Just do your best to eliminate plastics from your food and Tupperware, and don't wear perfume or buy scented products. Just start there. And let's not forget the timing. Tracking ovulation is crucial because the fertile window can be shorter at this age. So the egg viability is only 12 to 24 hours after you ovulate, which is important that you're tracking for ovulation. So accurate timing does make a difference. And a final note, this is not always all about you. Your partner's sperm health also matters. Age, alcohol, smoking, obesity can all affect sperm. So while it's not impossible to get pregnant naturally at the age of 40 and beyond, if you've been trying for 6 months or longer, it's probably a good time to go see a fertility specialist. And this is because early evaluation helps to rule out tubal, uterine, and hormonal issues. But also it allows you time to prepare for IVF if you choose to go down that route. It also gives you enough time to move forward and see if you're a good candidate for medical intervention like PRP, plasma-rich platelets, which can improve your egg quality. The real discussion here is just how much time do you have and how much energy as these will decline. Becoming a parent in your 40s is different than if you were in your 30s. I know this from my own personal experience. So if you want to take into consideration your current health status and energy levels, there's a massive emotional toll related to miscarriages at this age, and that also has to be taken into consideration because the quality of the egg and the quality of the sperm are not going to be ideal, and there's only so much heartache a person can take. So the key to all of this is knowing your own body and knowing your own energy levels, and so you can plan wisely and understand your body's unique timeline. And at some point, if pregnancy is not occurring for you, you can always have a discussion with about donor eggs, which I will make a video in the next one about that. So can you get pregnant naturally after 40? Yes, but it requires more awareness, patience, and proactive care. The odds may be smaller, but they're still real. Biology gives you fewer chances, but they're still there. And with modern science, good nutrition, and early action, your 40s can still be a fertile period. Just a little bit more strategic. So that's the takeaway. Informed optimism. Not false hope, not fear, just facts. But if you're in a rush and now you're looking for other options, please see my next video on donor eggs. Please like and subscribe as it helps me to continue to make more videos. I hope you found this helpful. Thanks for watching.